Since starting residency now 2.5 years ago, going into my 3rd year, I have found this place to be amazing, as I expected it to be when I interviewed here. I have made amazing friends, lifelong colleagues. The attendings are incredibly helpful and provide a lot of lifelong education. Everyone at this hospital is easy to get along with, and you can just feel the compassion they have for medical education, and then more specifically and important, the patients and the patients' families.
We train 12 residents a year in general pediatrics with a goal of producing excellent general pediatricians who are well prepared to practice in whatever setting they choose, whether that be in a rural or urban general pediatrics environment, prepare for subspecialty training, or enter academic medicine, or anything in between.
One of the main things is being exposed to all the specialties, but also really solid general pediatrics. You see a little bit of everything. You see your gen ped stuff, but you also see your more rare stuff. And so from here, you can learn so much from the diversity of patients, the diversity of pathologies, the diversity of medicines used.
We do a lot of inpatient care, but we also have a great outpatient clinic set up. You do a continuity clinic once a week, and it's your same attending, your same colleagues in that clinic, and you get to have your own panel of patients. And you can also do private practice in the community.
We're going to make you work hard, but we're also going to make sure that you are totally supported during the entire time you're here.
We want somebody, of course, who's motivated, someone who's hardworking, that goes without saying. But we also want someone who's resilient and able to move with changes, alter their style with changes that we might recommend. We want someone, of course, who ideally would be interested in research, but we also need primary care physicians.
The attendings definitely take the time to teach us every day and every time that they get the chance, but they also encourage us to get in there and be the ones that are involved.
I think it's really easy to say, well, I've not seen this before, why don't we go look it up? We can talk about it collaboratively and come up with a plan together.
I started on our inpatient rotation, and there's 4 interns on the inpatient rotation, and then there's 5 different upper levels, and everyone had your back from the get-go. They walked us through and taught us how to be the most efficient as possible.
With the clinical workload that we have here, with the volume of patients that we have here, combined with that teaching, you're going to be a phenomenal physician no matter what.
We have what we call the Pediatric Education Committee, and it's composed of faculty as well as residents, and their voice is heard. They fill out a survey every month about particular rotations, what's working great, what might not be working so well, and we talk about that, and based on the residents' input, we make those changes, not in a year, not in 2 years, we make those changes tomorrow, within the next week, to make the experience better for the resident.
We spend a lot of time taking care of our residents outside of the hospital, and we really do make an effort to get to know them individually and to give them time outside of the hospital to pursue their other interests.
The most important thing to know about this program is how we are a family. We're there for you from day one, forever on.